Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And here at Gold, we are getting ready for our Gold Lactation Online Conference of 2022. And with me here is one of our speakers, Rosann Edwards. Welcome, Rosann. It's wonderful to have you here.
Oh, perfect. Thank you, Kristen.
Lovely to have you here. And you are presenting on a topic that we in our time see more and more about. It's about older parents, first-time parents, right? But we will hop into that in just a little moment. But tell us, first of all, where in the world are you located?
So the study and the moms that we're going to be talking about during my presentation is actually in Ottawa, Ontario. So
Okay.
we're in Canada here. I'm
Canada.
Canadian, but currently I'm in St. John, New Brunswick. So that's where I'm coming to you from today. The small but mighty St. John, New Brunswick, right on the Bay of Fundy. So
Beautiful.
right along the Atlantic Ocean.
Oh, beautiful. Thank you for
Hmm.
letting us know about this because we have such an international audience. It's always lovely to hear where we are in the world. I'm coming to you here from South Florida. So we're just a little bit away
Yeah,
from each
just
other.
a little bit,
Just a little.
probably a little bit warmer than where I
It
am right
is.
now.
That is true. So you are an assistant professor, and tell us a little bit about your professional journey and your background, and then we'll get into your topic here at Gold.
Sure. So, I mean, right now I'm working as an assistant professor in the School of Nursing and Health Sciences, so the Department of Nursing and Health Sciences here at the University of New Brunswick, St. John. I work with nursing students. I also work with health sciences students, so students who are striving to go somewhere into the healthcare system, whether as radiologists or later on as physicians or as nurses, or they just have a general interest in working with people in healthcare. But mostly I work with nursing students right now. My specialty is obstetrics, mother baby,
Mm.
lactation, of course, and community health nursing. So, working with vulnerable populations. I've only been teaching for about 2 years. Most of my career I spent as a frontline public health nurse and lactation consultant in Ottawa, Ontario. So, working with moms who were dealing with as long as they were pregnant or their youngest child was under the age of 6 years of age, I could work with them through the Healthy Babies, Healthy Children program. And we worked with moms who were dealing with addictions, with homelessness, intimate partner violence, children with developmental delays, children who recently had been discharged from the neonatal intensive care units and needed a little extra support. But of course, also many, 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 many moms who, on top of all of these other things in their life circumstances that were happening, needed support with breastfeeding,
Right.
including more and more over my career, over the course of about a decade and a half, working in that area, I found that I was working with more and more moms who were quote unquote older.
Mm-hmm.
So moms 35 and over, generally mid to late 30s, early 40s, some even into their late 40s, early 50s, which at my point in life now I say, hey, that's not that old. But from
Yeah, right.
from a childbearing standpoint, it's older than what's been the norm for most
Mhm.
of history for a first baby.
Yeah.
And so it started piquing the questions,
Hmm.
why are these moms waiting? Why are so
Right.
many of these moms having problems with breastfeeding, and why is it negatively affecting their mental health in a way that it didn't seem to be negatively affecting the mental health of my younger moms?
It's
Because I also work with a lot of very young moms.
right. Right. That's
Yeah.
absolutely fascinating. And I'm glad you're looking into this because as you mentioned, there's more and more older, parents who are delaying maybe childbearing or,
Yep.
weren't able to have children earlier on in life. And here I can tell you also, I'm a midwife often, over the age of 35, they get that big old stamp on their file saying
Yes,
advanced
they
maternal
do.
age, right?
Yep.
And
Yep.
I was one
We
of
will.
those and I was like, no, I'm not old. You're treating me like a geriatric person
We
here,
will.
and all of a sudden all these extra tests are
Yeah.
being put on moms and
Yeah.
they
For
they
sure.
almost were making
Yeah.
being made felt like oh my
Well, for
gosh,
sure.
as this kind of huge issues there,
You're
and
outside of the norm.
you're
You're no
outside.
longer what we consider that normative mother, right?
Right.
That
Right.
ideal mother. You're doing something that you
Right.
should not be doing. And yeah, no,
and
for sure.
and many families that delayed, childbirth because they either weren't ready or financially not able to, or
Yeah,
for whatever reasons, right? They're
so
saying
many
like,
reasons.
I'm here now, I'm
Yeah,
doing this, I'm 100% invested, and
exactly.
I'm treated A like this, and B, there might be issues that are arising due to, an older first time, parenthood. So tell me what you've seen in your practice, or what you've come across that maybe even surprised you.
So I think the biggest surprise was how invested the moms that I was working with, and the moms that I found while doing my doctoral research, how invested they were in breastfeeding as their
Hmm.
part of their maternal identity.
Yeah.
This was huge. This was
Wow.
the thing that was going to make them feel like a mom and act like a mom, and other people were going to see them as a mom.
Hmm.
There was so much tied in with that early breastfeeding. And then there's so many reasons why often it didn't go very well.
Hmm.
Um, the not the smallest of which is that older mothers, especially here in Canada, but I think this is true on many developed countries, are have disproportionate rates of cesarean sections, of
Hmm.
epidurals, of just birth interventions in general, that for a variety of reasons
Right.
often get breastfeeding off to a rocky start. Um, so they're disproportionately affected. They disproportionately, like you were told, you're high risk. We're going to give you every prenatal screen and test under the
Right.
sun, just searching for something that
Searching
has
for
to be going
something.
wrong here,
Exactly.
right?
Exactly.
Exactly, exactly. Um, and even personally, I had my first child in my mid 20s. I had my second child in my, mid to late 30s, and
Hmm.
my first child, I had no prenatal screening. We were good. My second, every single test. I thought, wow,
Hmm.
for first time mothers, this must be very anxiety producing.
Right.
Um, and that sets you up at a point where you're already feeling kind of unsure about the
Yeah.
pregnancy, the birth. You're being set up, that you may have a C-section. You've been set up that there might be something wrong with the baby. They're monitoring everything from your blood pressure to your weight gain to so you coming into this. I found that the moms were coming into that very early postpartum period where I would get them on my caseload, sometimes
Right.
at 2-3 days postpartum, um, already anxious,
Yeah.
already worried that this wasn't going to work out. And I found there was a lot of research on younger moms. Well, there's still not a ton of research on our younger moms. That's part of the research I've been working on and I'm working on again. But with the older moms, there really wasn't anything out there. So that prompted well, why don't we look at this? Why don't we ask
Hmm.
them?
Hmm.
Why don't we,
Hmm.
at least start asking the questions? Um, what's going on here? Um, yeah, and this has been a trend for the past 30 years that our older mothers, first time mothers, are there's more than our younger first time mothers. And this is shifting. More and more women are having delaying childbearing for a variety of reasons.
Right.
Um, so more and more of the mothers on our caseloads as healthcare professionals, as lactation consultants, as professionals, as peer supporters, as friends, as families, as women,
Hmm.
and humans supporting other women and parents and humans. um, More and more this we are going to be seeing older moms and really understanding where they're coming from is so important to a woman, and a parent-centered focus,
Hmm.
especially within lactation care.
Yeah, yeah. And you mentioned something that is very true. I've seen this also in my practice. People, first-time parents also at an older age coming in, they're extremely well educated about
Oh, yes.
pregnancy and birth, and what they want for their birth,
Yes.
what they want for their pregnancy, what they want for their baby. Of course,
Yes.
they have taken read tons of books or
Yep.
done tons of courses, and
Yep.
so for them it must be um difficult. Not to say that's not difficult for a younger person at all. I'm not
No.
minimizing their struggles at all, but then going through all this and feeling ready and prepared,
Yep.
and then things not going well, then they start doubting on their
Yep.
capability as a parent too, right?
Oh,
I've
for
seen that
sure.
too. So like,
Yep.
I've done everything, I've read every course, I've
Yep.
done everything. This is not working. What am I doing wrong? Am I not cut out to be a mom or parent?
Exactly. Is there something wrong with me? Is there
Me.
something wrong with my baby? You hear that a
Yeah.
lot too. Like, what
Yeah.
is wrong here? And that comes up. You sum it up with expectations, right? There's
Mhm.
very, very, very often. I mean, older parents, older first-time mothers, older first-time parents are not a homogeneous group. I mean, this
No.
is a group that has
Yeah.
every background we can think of, every socioeconomic demographic that we can think of, every reason that we can think of for either waiting to have children, delaying childbearing, or having childbearing delayed for
Yeah.
external reasons,
Right.
sometimes external circumstances, sometimes simple physiology,
Mhm.
sometimes finances. I mean, there's all
Yeah.
sorts of reasons. We will talk about that when we
Mhm.
during the presentation. So there's a spoiler. Um, and I have a book chapter coming up talking about that too in Demeter Press. So there's another spoiler if anybody wants some interesting reading
Absolutely.
in the fall.
So please,
But
yeah, tell us a little bit about that. Tell
oh,
us. Yeah, since
oh,
you're
okay.
at it.
There is Demeter Press, which is a matrocentric feminist not-for-profit press out of York University, run by the powerhouse Andrea O'Reilly, who the press focuses on motherhood and issues around motherhood, including breastfeeding. Um, and they're bringing out an anthology on normative motherhood. And I have a chapter in there looking at the changing norms of normative motherhood and older first time mothers, and looking at the history of fertility and motherhood in Canada, and then the current situation and how older moms are really pushing back. They're really redefining what motherhood looks like for them, and very much in a rebellious very much in a rebellious kind of way, and
Mhm.
taking it back for themselves, taking ownership over motherhood for
Oh, that's
themselves.
great to hear.
And we'll talk a little bit
Yeah.
about that in the
Okay.
presentation too. We could talk
Great.
all day about this. So,
I
and I
know.
know we don't have all day, so we will not do that.
Oh, but fantastic. Well, Rosann, I'm really looking forward to your presentation. Sounds very informative. Lots of good information in there. So before I let you go, one
Mhm.
little piece of advice or nugget of wisdom will you leave our viewers here with today with regards to the topic?
Always, always, always start by asking your client, your patient, your mother, the woman, the person, the human that you're supporting, what they want, how they feel about this. How are you doing? How are you feeling about this?
Hmm.
What do you want this to look like, and how can I help you get there?
Yeah.
Always take your own expectations, put them to the side, your own agenda, put them to the side. I'm guilty too. I always have an agenda. Put it to the side and start with them. Start with them and their baby, and go from there.
Oh, thank you. That was beautiful. Thank you so much, Rosann Upwards, to sitting down here with me and chatting about your life, your background, and the wonderful presentation that you will have here at our Gold Lactation Online Conference.
Wonderful. Thank you, Kristen. Thanks for the opportunity.
And to our viewers, if you would like to find out more about Rosann's presentation and all the other presentations that we have available at the conference, and we get started on April 4th here, just around the corner, you can find out all the information on goldlactation.com. So go there and visit, and I hope to see you all at the conference. Bye bye, everyone.
Cheers.